All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out BehavioranalystStudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. The practice manager at a pediatrician's office has noticed an increase in tardiness lately from the staff. The manager sends out a memo telling the staff that each day one person will be randomly selected. If the selected person is on 5 days in a row, then the staff will have lunch bought for them. What type of contingency is this? So we have a contingency question, and it's going to be a group contingency, right? Because we have a whole staff that is going to be affected by the contingency. So our group contingencies involve independent, interdependent, and dependent. For our independent, each person is responsible for themselves. For our interdependent, the whole group is responsible for everybody else. For dependent, for the hero procedure, one person or a sample is responsible for the whole group. Which one applies here? Well, if each day one person is selected, and that one person has to be on time for the staff to receive reinforcement, that's going to be our hero procedure or our dependent group contingency. A client has been receiving a reprimand whenever they engage in self-injurious behavior. This reprimand effectively reduced the frequency of the behavior, but has also led to increased anxiety. A new therapist who has established a good rapport with the client and is now delivering the reprimands notices that the client's anxiety levels are still escalating and the behavior is increasing again. What is a plausible explanation for this change in the client's behavior? It's a behavior question. So what do we know about the client's behavior so far? We know they are getting reprimanded for self-injury. We know the reprimand was effective, but caused anxiety. We know now that a new therapist is delivering the same reprimands and is noticing anxiety levels are still high, but the behavior is no longer being decreased, it's now increasing again. What might have occurred given these facts? A, the therapist paired with a reprimand and is affecting the anxiety. Quite possibly. If the reprimands led to an increased anxiety, and now the therapist is delivering the reprimands, it's possible the therapist has paired with the reprimands themselves. B, the effects of the punishing reprimand wore off. Also possible. Things we know about punishment. Punishment isn't permanent, meaning punishment, if not continued, or if continued for too long, will lose its effectiveness. And it's quite possible these reprimands are no longer having the same effect on the behavior, but are still affecting anxiety. C, the client is experiencing resurgence. We don't talk about extinction at all, and resurgence is related to extinction, so it can't be C. Possible, therapist paired with the reprimand is affecting the anxiety. Possible, the effects of the punishment reprimand wore off. We don't know for sure, but those are plausible and possible explanations. So the answer here is both A and B. Using a fixed ratio schedule that provided reinforcement every 3 correct responses, a client was able to learn to communicate when they were hungry without engaging in shirt pulling. When the schedule was changed to a variable ratio 8, the client stopped communicating as well and started to engage in shirt pulling again at lower rates. What should you do in this situation? What do we know immediately about the situation? We know we went from a fixed ratio 3, so a pretty thick schedule, to a variable ratio 8, a rather thin schedule. That means response effort increased, amount of reinforcement decreased, and in a very quick amount of time. When you thin a schedule too quickly, you may experience, or the client may experience, ratio strain, where they are no longer going to engage in your responses, right? And they might engage in the old behaviors again, because the reinforcement schedule has been thinned too quickly and it's too much effort to get reinforcement. If that happens, what should you do? A, change the reinforcement schedule to a continuous schedule. Well, in this case, the FR3 was working. So we don't want to go even more backwards, right? Because FR3 was effective. B, introduce a punishment procedure since reinforcement was ineffective at maintaining the change. Reinforcement was effective up until we thinned the schedule. So introducing punishment before reevaluating reinforcement is not the best plan. C, thicken the schedule again and then slowly thin out the schedule. Yes, if we're going through ratio strain, let's re-thicken the schedule and then thin it more slowly next time to try to fight ratio strain. D, conduct a new functional behavior assessment to evaluate why this may be occurring. It's the same behaviors. You've already done the assessment. Be parsimonious. What changed? The amount of reinforcement available and the response effort. How can we fix it? Let's revert what we changed first. If that doesn't work, then we can get into something that's more complicated. This is when being parsimonious really works to your advantage. You're teaching your nephew to recognize the letter A in the natural environment. You begin by presenting the letter A written in big and bold font next to other letters written in a normal font. Once the client starts exclusively identifying the A, you start to write the A in a more normal font until it matches the other letters. What is occurring? Very straightforward question here, right? We have a situation where we're writing big A and then we have smaller letters. So immediately, what are we doing? Well, the salience of the stimulus has increased and we're focusing on this big, bold A. Once they identify A consistently, now we're going to start to match that A to the other letters until they match completely, right? And so what are we doing relative to the A? Well, we're fading out the stimulus. To begin, it's a giant stimulus prompt, right? The A is just magnified. Slowly, we're going to fade out that stimulus until it matches everything else. B, errorless learning. Just because we have a giant letter doesn't mean errors can't happen. So we're not preventing errors from occurring. C, naturalistic teaching. Well, this seems pretty contrived. It doesn't appear that we're using natural situations to teach and take advantage of. And then D, shaping. We aren't necessarily discussing approximations, right? We are getting the client closer and closer to identifying A, but in a way that's only really affected by the size of the letter. And so what we're focused on here is fading out that giant letter A to more normal. We're looking at stimulus fading. A soccer team is doing conditioning drills, which include sprints and cone drills. After 10 minutes of conditioning, the team is allowed a 2-minute break. The team is then required to do 20 minutes of conditioning before their break, followed by 30 minutes of conditioning. What type of schedule is most represented here? All right, basic reinforcement schedule question. What do we know? We know after the first 10 minutes, there was a break. So that was an FI 10. But then it goes to 20. So it's no longer fixed, right? So now we have to think about, we have a schedule of 10 minutes, schedule of 20 minutes, schedule of 30. So this is definitely variable. And in order to find the variable interval schedule, we need an average. And of course, the average here is going to be 20 minutes. So what type of schedule is represented? A, chained. It's not chained because this is not a compound schedule question. It's a single reinforcement, simple reinforcement question. B and D both have to do with fixed schedules, and we know this is variable because it's changing. So it has to be C, a variable interval 20. Very straightforward, simple reinforcement schedule question. You're at a party with your husband and are discussing what you do for work with another couple. The couple is interested in your day-to-day role, so you tell them that you work on things like communication and socially valid behaviors. They ask how long it takes usually to see results with ABA, and you tell them that you can pretty much guarantee results in under 3 months. Is there anything wrong with this statement? When you're reading this question, as soon as you see this idea that someone is guaranteeing results, alarm bell should be going off. You should be reading these questions critically. Your job is not to read the question as quickly as possible. Your job is to attack the question. Don't worry about the answer choices. Attack, attack, attack. What's wrong with this statement? Well, they're guaranteeing results. That's going to be our answer. So A, no, as long as you have data to back up your claim. Well, maybe your results have been under 3 months, but every single time and every single ABA practitioner ever, no. So this is just not going to be a good representation of our field. B, yes, you should not be discussing your clients with outside individuals. You're not discussing clients, right? They're just asking about how long to see results. So you're not really violating privacy, but you are C, potentially misrepresenting the field of ABA. You can't sit there and guarantee results in under 3 months. That's not a good thing to do relative to the field of ABA. You can't misrepresent what we are and what we do. Dr. Franklin is discussing radical behaviorism and methodological behaviorism with a couple of his students. His students want to know how to differentiate between the two philosophies. How might Dr. Franklin explain the difference simply? So let's put ourselves in the shoes of Dr. Franklin and try to explain the difference between radical behaviorism and methodological behaviorism. A, radical behaviorism considers private events like thoughts and feelings as behaviors subject to analysis. That's true. Whereas methodological behaviorism excludes them from the study because they are unobservable. Also true. A seems pretty good. Read all your answer choices. B, radical behaviorism focuses solely on observable behaviors and disregards internal states. Not true. B is not the answer. C, both radical and methodological behaviorism treat internal events as causal factors, but differ in their approaches to measure them. That's not necessarily true either. Methodological behaviorism acknowledges they exist, but they are not a factor in the analysis. D, methodological behaviorism emphasizes genetic and biological influences on behavior, whereas radical behaviorism focuses exclusively on environmental events. That's also not true, right? Remember our idea behind the phylogenetic history of our learners and ourselves. So how would we explain this simply? Well, A is going to be the best answer. Because the radical behaviorism considers private events like thoughts and feelings as subject to analysis, whereas methodological behaviorism excludes them from study because they're unobservable. Megan conducts a survey with her staff regarding what they would like to change about supervision. The survey results indicate that the staff is disappointed in the lack of modeling they receive from their supervising analyst, but they are happy with the amount of supervision they receive. What should Megan do with this information if she is in charge of managing and training personnel? So it's up to Megan to take the information and do something with it. Now, what information does Megan have? Well, she's surveyed her staff about supervision, and they said they want more modeling from the analyst, but they are happy with the amount of supervision. What should Megan do next if Megan is in charge of managing and training personnel? A, Megan should reprimand all the behavior analysts for failing to model on a consistent basis. Megan hopefully didn't conduct this survey so she could punish the analyst. Megan is doing a good job as a trainer and a manager and soliciting feedback. So A is not right. B, Megan should require all the behavior analysts to dedicate 10 hours of continuing education to modeling procedures. That does not seem like a great way to spend 10 hours of CE when Megan and hopefully the analyst should already be pretty familiar with modeling. So what can they do internally? C, Megan should meet with the behavior analyst to discuss the results of the survey and outline a plan. Yeah, take the feedback, implement the feedback. That's why she gathered feedback in the first place. D, Megan should question the results of the survey since information was collected indirectly. Is indirect data as good as direct data? No. Is it useful? Yes. Megan needs to take that feedback and now implement it with her staff. Lucy has started to speak more unprompted, but currently speaks at a very low volume that others find hard to hear. Lucy's analyst begins reinforcing any instance where Lucy speaks slightly louder than usual. As Lucy meets each volume criterion and the analyst raises the requirement for reinforcement to a slightly louder volume, while the actual behavior of speaking remains the same. This procedure is an example of what? Interesting question, right? What type of procedure are we doing here? Well, Lucy is speaking unprompted, which is great, but she has to speak louder. So the analyst is shaping Lucy's volume. Now, we have these ideas of shaping across topographies and shaping within. When we're shaping across, we're changing the fundamental look of the behavior. That's how we typically think about shaping. When we're shaping within, we're changing some aspect of behavior. So in this case, the behavior is the same, but what I'm doing is different. I'm changing a dimension of the letter. Here, I'm changing how the behavior looks as a whole. For Lucy, are we changing Lucy's behavior as a whole or just some measurable dimension or aspect? Well, all we're focused on here is the volume of the speaking. So what we're doing is shaping within topographies. Roman is running a multiple baseline design across settings using an intervention he designed. Data from the first setting, the home, indicate a significant change in level from baseline to intervention, while baseline remains steady for the other two settings. When Roman introduces the intervention to the next setting, the clinic data indicate the same significant change in level. What aspect of baseline logic was represented by baselines remaining the same when intervention was introduced elsewhere? That is a mouthful, right? Long question. It just feels tiring to read that question. When you get in a situation like that, you have to remain focused and you have to attack the question. Don't get lazy and jump to answer choices. What do we know? What is the question asking? The question is asking about baseline logic. So prediction, verification, replication. And they want to know what is represented by baselines remaining the same when intervention was introduced elsewhere. So immediately that tells you the answer. And all of this stuff doesn't really matter because what do we call it when we have a situation where our baselines are remaining the same regardless of interventions being implemented elsewhere? Well, we call that verification. We predict when we first start baseline that that baseline is going to continue if intervention is not introduced. If we continue baseline in our second multiple baseline condition and our prediction is verified, we're going to call that verification. It tells you the answer right here. All the other stuff doesn't even really matter. And that's why we attack the question, because that long question becomes very simple if we understand the information that is given to us. Thanks for watching. Be sure to subscribe. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.